Any injury, serious or not, may cause bleeding. It is important to know what to do if you or someone you know is bleeding heavily.
There are 10 pressure points located in the body. Pressure points are to stop blood flow from the heart to the area where bleeding occurs.
It is important to apply pressure when someone has a wound because the blood may not clot or ever stop bleeding.
The pressure points include facial, temporal, carotid, subclavian, brachial, lunar, femoral, radial, popliteal, and tibial.
Now let's take a look at these pressure points on the human body.
For any wound of the temple or scalp, use the temporal pressure point. For any wound of the lower face, use the facial pressure point. For any wound of the neck, use the carotid pressure point. For any wound of the shoulder or upper part of the upper arm, use the subclavian pressure point. For any wound of the lower part of the upper arm and elbow, use a brachial pressure point, as well as a wound of the lower arm. For any wound of the hand, use the lunar and radial pressure point. For any wound of the thigh, use a femoral pressure point. For any wound of the foot, use a tibial pressure point, and for any wound of the lower leg, use the popliteal pressure point.
If severe bleeding does not stop with direct pressure and elevation, apply direct pressure to an artery. Use direct pressure on an artery along with elevation and direct pressure on the wound. There are specific major arteries in the body where pressure should be placed, according to Harvard Health publication.
According to Harvard Health publications, when you apply pressure to an artery, you stop bleeding by pushing on the artery against the bone. Press down firmly on the artery between the bleeding site and the heart. If there are any severe bleeding, also apply firm pressure directly to the bleeding site.
According to Harvard Health publications, to check if bleeding has stopped, release your finger slowly from the pressure point, but do not release pressure at the bleeding site. If bleeding continues, continue to apply pressure to the artery. Continue until the bleeding stops or until help arrives. After bleeding stops, do not continue to apply pressure for no longer than 5 minutes.
In this situation, we have a patient with an open wound on her forearm. First, we will apply gauze to her open wound. Next, we will push pressure down on her brachial pressure point to slow down or possibly stop the bleeding. If the bleeding keeps seeping through the gauze, apply another layer of gauze to absorb any excess blood. And keep your thumb down on her brachial pressure point. Stay in this position until any further emergency help arrives.
Thank you for watching our video on pressure points in the human body.